To the 31st Hazards Conference. 31st one, a bit different from the 30 we've had previously. And because it's different, we're going to be doing things differently. My name's Doug Russell. I'm the National Health and Safety Officer for the Union of Shop, Distributive and Allied Workers. And I'll be chairing this morning's plenary session. And because we're doing it online, we thought we'd try and do something a bit different. I'm not going to talk for too long for an introduction, as it'll become apparent as I explain why would we go through this. We normally always try to have at least one international speaker at the Hazards Conference, usually in the Friday night plenary. But this year, because we're doing it all online, we've gone a bit overboard, and we've actually got 8 speakers lined up to speak to you from literally around the globe to give us a snapshot of the occupational health and safety issues that people are campaigning on across the whole of the world at the moment. So it's quite exciting. If the technology holds up and we actually get it to work, it'll be a unique experience, I think. But it does mean that the timings are very tight. I've already warned most of the speakers that I'm going to be actually very rude and very strict in the chair and give them only 10 minutes each. We might have to fiddle around with the running order a little bit slightly as well, because one of the speakers has to leave promptly at 11:30. It does mean there won't be any time for questions and answers during this session because we've got those 8 speakers lined up, but we have got the chat function on Zoom. So if you want to put any comments in the chat function as we're going along about what's being said by the speakers, or if you've got any questions directed at any of the speakers, then use the chat function to put the questions in there. And after the meeting's finished, we'll pass them on to the speaker concerned and ask them to get back to you outside of the meeting if they can. So hopefully that'll mean we get some useful dialogue out of this as well. Just before we start, it's worth remembering that every year we do lose some of the activists and campaigners that we've had campaigning on these issues for a long time. And it would just take a second or two just to remember those we've lost this year. Particularly recently, we lost John Listerman in the States, who has been a campaigner on issues around occupational health and safety and justice for a long time. So we're very sad by that loss. But if we just spend a couple of seconds of quiet contemplation on those people we have actually lost. Thank you, that's very good. And can I ask those of you who are joining the meeting, if you're not actually a speaker, if you could actually just mute your audio and also turn your video off, just so as we can see the speakers on the screen, that'd be very good. Thank you very much. Because I want to try and move on fairly quickly and get started with the first speaker, otherwise we're going to run out of time for the whole thing. And the first speaker we're going to start off with is from Scotland, and that's Louise Taggart, who is working for the Scottish Hazards Centre, and also a very, very active member of the Hazards Campaign and Families Against Corporate Killing, FAC, in the UK. And she's also a powerful motivational speaker on health and safety issues, and it was all motivated, sadly, by the tragic death of her younger brother, Michael, who was electrocuted in a work accident a few years back. So I'll hand you over to Louise. Louise, you've got the floor.
Magic, thanks Doug. In the weeks leading up to this year's International Workers' Memorial Day, our FAC hearts, they'd collectively felt the heaviest they had for quite some time. You see, many of us had already lived for a decade or more with the heartbreak being inflicted on those losing loved ones to COVID-19. Like them, we didn't get the chance to say goodbye. Like them, we know that the deaths of our loved ones could and should have been prevented. And like us, they know there will be no justice for their grandparents, mums, dads, siblings, or children. And we all know that we'll never know the whole story. And so, as we sought the words to give voice to our thoughts ahead of Workers' Memorial Day, we were worried that it was just too big an ask until it struck us. We'd said all that needed to be said before. While our words had previously been said in challenge to work-related incidents and illnesses, there were chilling parallels to the pandemic crisis which was engulfing us. We FACers, we remember all of the dead, having repeatedly implored that each and every work-related fatality should be recognised, counted, and therefore be made to count. The HSE figure of 111 fatalities last year is a gross underrepresentation of the true work-related death toll. It doesn't include those who die in maritime or air incidents, who die on our roads while working, or who die by work-related suicide. It doesn't count members of the public who die as a result of work-related activities, nor the huge numbers killed by occupational illness. When all of those lost loved ones are counted, as they should be, in any what would sadly be deemed normal year, We reach near 1,500 who die in work-related incidents and a further 50,000 who die each and every year as a result of work-related illness. But unless that true toll is set out in plain sight, depth of impact, it can't be measured. Lessons, they can't be learned, and future needless loss of life can't be prevented. The very same thing is true for COVID-19 fatalities. Government advisors said at the outset that if deaths in the UK could be kept to under 20,000, that would be a good result. Utterly disgusting then, and even more disgusting now as the official death toll stands at more than twice that number. And the whole story? Well, is it approaching or has it already surpassed at least 3 times that number? As Professor Andy Watterson has stated, if you do not protect the workforce in a pandemic, you do not protect the public. And so to stop the pandemic at work, we need to understand where all of the deaths are occurring. But we've no idea how many workers have died as a result of work-related exposure. Best guesses include more than 500 health and social care workers, at least 50 transport workers, and 200 construction workers, security staff and cleaners. And these job roles in themselves, they tell a story. Because we FACers have been clear that the work a person does often results from inequality and that it often results in health inequality. The lower your pay grade, the higher your health and safety risks, whether from overwork, exposure to cancer-causing substances, the inability to turn down overtime or shift work, or the worry about speaking up on health and safety for fear that you lose your job. So it is for COVID-19 fatalities. The lower your pay grade, the more likely you are to be exposed and the less likely you are to be able to remove yourself from that harm without losing your income or your job. Nurses, porters, care workers, bus drivers, retail assistants, delivery drivers, key workers who all deserve so much better from the government and enforcement authorities, just as our FAC lost loved ones did. But we FACers, we remain resolute, principally because the precious memories of our loved ones fuels us in our fight for the living. And so it is for those who have bravely spoken out about the threat from COVID-19 in their time of overwhelming grief. Who could have failed to be moved by 16-year-old Bethany Pearson, who laid bare the pain felt on going to bed one night, knowing that her beloved dad was feeling maybe a 5 out of 10, only to wake in the morning to find out that he was gone. She said the saving grace for her family was that it still felt unreal. And we FACers, we know only too well that that lack of reality, it is lasting. Because our hearts break all over again when we repeatedly have to hear that a work-related fatality was an accident waiting to happen. And on COVID-19, so many preventable deaths have occurred and are still occurring. So we wept for Dr. Abdul Mahmood Chowdhury's family. He's a consultant urologist who wrote a post on Facebook directed at Boris Johnson, warning that healthcare workers urgently needed more PPE. He said they had a human right, like others, to live in a world disease-free with their families and children. He lost his life 5 days later. In the aftermath of his death, his son Intizar said, "My father would not be afraid to point out what was wrong because he cared about people, co-workers, colleagues, family, people he'd never even met." And we FACers, we know just who it is that does care. Those who operate our hazard centres and the hazards campaign. Those trade union safety reps who fight with every ounce of their being for hearts and minds and to prevent loss of life. We know that trade union workplaces are safer workplaces, whether that be day to day or when battling a pandemic. We FACers have said that life and limb will be lost. Life and limb are being lost as a result of the continued denigration of health and safety by politicians and also vast swathes of the media. To hear those who have so denigrated and demolished health and safety protections over the years implore us all to stay safe, well, it more than sticks in the craw. Because we FACers, we've said all that needs to be said before. So until such time as people, not profits, are paramount, until lives are prioritised over livelihoods, until this government's abject carelessness is replaced by the type of exemplary care being shown by those working in our NHS, we FACers will continue to fight for your right not to walk in our shoes. We will remember all of the dead and pledge to continue fighting like hell for the living.
Thank you very much for that, Janet. Hey, Louise, that was very powerful stuff as usual, and very concise and very clear as well. It's important that we all do recognise the occupational and employment side of the COVID pandemic that's going on. It is a big public health issue, but a lot of it is going on in workplaces, and it's very important we recognise those who are suffering as a result of needing to go into essential work and keep the country going. Thank you very much. That's very powerful. Can I just remind everybody as they join the meeting, if they're not speakers, just to make sure they're muted and to turn off the video as well, just so as we can keep the speakers' faces up on the screen. And I want to move on next to, I said this was going to be a global event, we're moving on next to Tasmania to listen to Michael Quinlan, who is Emeritus Professor at the School of Management at the University of New South Wales, and is speaking here on behalf of their Industrial Relations Research Centre. Michael's an academic with a track record of research for Australian and New Zealand governments. A lot of work with organisations like the WHO and ILO on occupational health and safety issues. So over to you, Michael. You're muted, Michael.
Okay, can you hear me now?
Yeah.
I'm going to speak briefly on the experience of Australia with COVID and also on the impact of workplace death on families. As of today, Australia had 17,300 infections and 201 deaths. Country's about 37.5% of the population of the UK. 1,000 healthcare workers are infected and 3 are in intensive care. That's very low. Why? Australia closed its borders or very quickly defied the World Health Organization, listened to its own public health people and closed its borders to China and then to many other countries. It declared a pandemic before the World Health Organization. The government, state and federal, bizarrely neoliberal ones, listened to public health experts and followed their directives. There was a partial lockdown. A lot of early testing was done and contract tracing. And the state borders in Australia, which is a federal country, also closed their borders, most of them. There are also policies to keep people in work and also to pay higher supplements to those who are looking for work, and a massive economic stimulus. But then that was going really well, but it got worse. And what went wrong? Well, overseas returnees coming back into the country were being put into mandatory quarantine. One state used private contractors, they used subcontractors, and I guess I don't need to tell you what then happened. They were having sex with, reputedly having sex with the guests were leaving, they were swapping cigarettes, they were hugging. Many of them weren't paid. These were fly-by-night subcontractors, so there became a major outbreak in Melbourne. And of course, it went to the aged care sector, it went to the abattoirs, it went into the food distribution areas. What was the connector here? They all had large numbers of temporary workers due to neoliberalism, and that meant there was great spreading points through those centres. I want now to turn to what are the lessons of those experiences. First, neoliberalism is making these sorts of disasters both more likely and increasing the magnitude because there is no planning. Government is taking a reduced role. The pandemic had been predicted. Privatisation, outsourcing, flexible work. We know this from history. I did a study recently of clothing outworkers in the UK 160 years ago. They knew the connections between insecure work and disease outbreaks 160 years ago. So this is not new. The deindustrialisation and manufacturing and the incredible reliance on supply chains has created a world that is extremely vulnerable. The over-centralisation of resources, the downgrading of hospitals in regions, and that is also increased impacts. And of course, not to mention the reduction of worker voice and government union input. So a collective, and the corrosion of democracy basically, which is going on around the planet. Australia is not exempt to that. If I briefly turn now to the workplace death, where we did a major study of family impacts of workplace death, including a global survey of the US, the UK, Canada and Australia. We found significant mental health effects on the family. 61% of the people we surveyed have post-traumatic stress disorder, 44 had major depressive disorders, and 42% had prolonged grief disorders. And some of these cases go back decades. And I don't need to talk to anybody who's experienced workplace death to know that. There's significant economic effects, but what do the families actually want? They want to know how and why their loved one died. 2, they do not want their loved one dehumanised by the legal process. 3, they want responsibility, and if there's a culpable party in a breach of legislation, a prosecution with a real deterrent effect. And 4, they want remedial action so that no other family ever has to go through that sort of incident again. Thank you.
Well, thank you very much. That was well done, Michael, and well done for keeping to time as well. It was, again, a lot of good information in there, very useful information. And thanks very much to Hilda Palmer for putting up in the chat box a link to some of your latest research on victims of workplace deaths. It is quite... Sorry?
You can go to, sorry?
You go ahead.
Go to my research page and get most of the publications.
Yeah, at the University of New South Wales. Yeah, that's right. The comments about neoliberalism were also very interesting to us in Britain, because one of the shocking things about the pandemic in this country that hasn't received much media attention is the way in which the government has passed over vast sums of public money to their crony organisations to run things like the failing central test and track system, for example, through Serco and organisations like that, rather than using traditional routes through local public health, which have proved to be more effective where they do operate. So it's been a bonanza for neoliberal private sector organisations in this country as the pandemic has progressed. I want to move on fairly quickly because we're actually managing to keep ahead of time at the moment, which is very good, because Janet will be very pleased with that, given the number of speakers we've got lined up for you. Our next speaker is from Denmark, from Copenhagen, and we've got Janne Hansen, who is a trade unionist from the Danish General Workers Union and is also active in the European Work Hazards Network. So over to you, please, Janne.
Yes, thank you. Many thanks for the invitation. I will speak a little about the situation in Denmark and what we have learned. In Denmark, we were closed down in March. Our government decided to close down nearly everything in the public sector to stop the pandemic. So every functions except hospitals, elder care, fire department, and so on was demanded to go home, and if they could work from home, they should work from home. And all the schools was closed, universities, caring of children, etc. And afterwards, they closed down some of the private sector. It was wellness, everything where you were in close contact between humans was closed down. But from a health and safety perspective, we could see that we were not prepared in Denmark for a pandemic. So we could see in our health sector, there was not enough personal protections for the people. We didn't have enough on our hospitals. We were out of gloves, we were out of alcohol for hands, and so on. And there was a bit of panic about that situation, and our hospitals and our government tried to get something from everybody, everywhere. But very quickly it came under control at our hospitals. But our elderly care, we have had a lot of problems because they still don't follow all the recommendations and so on in the elderly care. And in the elderly care, we see this small kinds of pandemic on local homes from elderly people. What we also could see is that some of the branches had special problems, and I would like to speak about our construction branch, because yes, the public sector was closed down, but the construction branch was still working. And in Denmark, we have a lot of migrant workers in the construction branch. And our Danes, we should stay at home, but people from other countries, Poland, Romania, and Italy, could come to Denmark and work in the construction branch where many is working, and they have no problem getting over the borders. So we have a huge lots of problem with the construction branch. One of the problems was also that when the government sent their employees home, they also sent our health and safety inspectors home. So when you caught the health and safety inspectors from the workplaces, you couldn't get them out to the workplace because they was not allowed to go out on the workplace. So that was a huge problem in preventing these things. What we did in Denmark, we had a very close dialogue between the employers' organization and the employees' organizations. So very quickly in the construction branch, they made information materials like this, and they made it in 8 languages so, to try to prevent the problems in that branch. But we can see that it was a huge problem that we couldn't get any inspections from our health and safety inspectors. What we can see now concerning compensations to people who works in different sectors, we can see in Denmark that we had now 772 cases notified, people applying for compensation. 75 of them has applied as an accident, and 697 has applied as an occupational disease. For the time now, they have made 58 decisions about compensation. 27 has been recognized, and they have all been recognized to people with a diagnosis as COVID-19. And we have 31 which has been rejected, but I must say that 15 of them is because they didn't answer the papers from our place where you can get the compensations. And we don't know why they didn't answer, but my guess is that some has applied for compensation and perhaps they found out that they luckily enough didn't have COVID-19, but perhaps it just was an ordinary cold they had. So that's my guess. In Denmark, we had a huge discussion about the compensation systems related to this, and the political pressure has meant that I think that it has been not easy, but a bit easier to get your compensation because of the political pressure. Right now in Denmark, we see that the numbers of people with COVID-19 is going up again, and I think we will have more restrictions in the autumn. And I think that was all here from Denmark. Thank you.
Oh, thank you very much. I'm most impressed with the way that speakers are keeping very much to time. It's great, but also some fantastic information again in there, Janne, about what's happening in Denmark. We've got a lot of lessons to learn from other countries in Europe as well as further afield about the pandemic and how it should have been handled in this country. But I mean, a lot of what you were saying it echoes the experience in this country, but in our case it was worse. So we still suffer from problems with shortage of PPE and equipment for people, particularly in areas like the care homes, because they've always been under supported in all of this. And indeed, at one stage, the government was sending people back from hospitals back to the care homes without any testing, and probably putting the virus into those care homes, which was one of the reasons why we saw so many people in the care sector actually dying as a result of COVID, which was quite a shocking thing to happen in this country.
I have a short comment.
Yes, sure.
Because I would like to say that most of the people who has applied for compensation are workers from healthcare or elderly care sector. I guess it's around 85% of them, which is from these sectors. So of course they are the people who will have the worst because they are in the front line.
Yes, very much. That's why you'd expect, obviously, as frontline workers.
Yes.
But there are some others who are frontline workers as well that need to be considered. And for example, transport workers on buses and in
Yes.
the country are very seriously at risk. Security staff are at risk, the ones who stand at the front of stores and shops and control access to shops. And
In Denmark, we closed down a part of our transportation sector.
Interesting.
And when it opened up again, you didn't go into the door near the bus driver, for example. You used the back door, and that was put something up to protect the bus driver.
You sort of eventually got there after a fashion in London, for example, but that's not the case in other metropolitan areas. No. Buses are designed differently. It's very difficult to implement that kind of system. So we've got a lot of things to learn from countries like Denmark about how these things develop and what we should have been doing to control it better than we have done. Thank you very much, Annie. That's extremely useful. If you've got a link to this discussion, those posters you put up, the construction workers that developed, if there's anything available online that people can see, if you want to put the link up in the chat box for us.
Yes, I do that.
Because these look great. I like the idea of self-organizing to try and make up for the absence of the inspectors because they were all safely stuck at home, unable to come out. Yes. Again, very similar to the experience in this country, I'm afraid. We're only just beginning to see them getting out and about and inspecting in the small numbers that are available to do it. I want to move on if I can, however, because we've next got Ram Charitra who's actually based in Nepal. So again, we're traveling around the globe a bit. Ram's here to speak to us mainly because he's the coordinator for an amazing network called ANROEV, which is the Asian Network for the Rights of Occupational Environmental Victims. And it brings together a whole host of NGOs and campaign groups throughout Asia who are campaigning for victims of, both local community victims and workers who are victims of hazards caused by employment and work in Asia. So over to you, Ram, please.
Thank you. Am I audible?
Yes, you're okay.
Okay. So thank you for giving us this chance to share what we are doing in Asia responding to COVID. So as you said that ANROEV is a coalition of victims group, trade unions and other labor's group across Asia and committed to right of victims and for overall improvement of health and safety at the workplace. Currently, we have 42 members across 7 Asian countries, and in addition to that, we have 24 associate members from 12 countries and some different regions. And one of the objectives for Secretariat is also to have more members. So welcome any of you interested for supporting or campaigning with us for the labor rights. Coming to the ANROEV activities, we conduct research, information sharing, publishing quarterly newsletters, website updates, social networking. We also organize conference meeting programs and undertake campaign and solidarity action, interaction with members and government, as well as making new members. So all of you are welcome if you want to support our campaign and so solidarity action and any other activities we foresee. Can you go ahead? Next slide, please. So I want to focus on this issue facing of Asian workers under this COVID situation. Most of the things is clear from the previous speaker as the pandemic threats upend labor relation. There was quite a good relation in some corporate, but during the COVID that has challenged. There are differential kind of issue with the different sector of workers, not only in terms of the work kinds, but also our genders of the workers as well as the physical status. I want to highlight that there's unpaid work, and there is some situation where 7 months without payment. 7 months without payment, even in the world-class work going on in Qatar for the FIFA World Cup, job loss, income loss, mental health has been already discussed, increased suicide. So even in case of Nepal, only in this pandemic time, over 500 people have gone suicide. Another is high rate of infection among the certain sector, exclusively on the worker. And there are couple of examples from Bangladesh, ready-made garment workers, about 73%. Even just a few days ago, 57% of the informal sector worker in Mumbai. And in Singapore, there was 88% of workers. Overall, total infection has been seen in the last May of month. Likewise, long-term livelihood and well-being and death and damage. Workers have forced to travel on foot more than 1,000 kilometers, an extra burden. And more of that increased industrial incidents has happened during this COVID situation, where a number of people, a number of workers has been died and affected. Please go ahead. And this is the example, a specific, like in Singapore, 88% of the total infection was the workers from who have been held in the dormitory. Next slide. There are a specific issue where the workers or the people have died in the isolation center, or the other in police custody, died without treatment and isolation. And even in the quarantine, there was a cases reported about the sexual abuse. And more of that migrant workers, they came traveling 2 days on foot, but they don't allow to enter in their country in the border area, and they died of without having food and shelter. So this is the specific case where the people or workers have got the. In addition to that, even this is the picture from UAE, published in one of the newspapers, saying that even our own embassy diplomatic mission didn't properly address the worker issue. And this is the worker who is just sleeping in front of the embassy, asking for their return, or their addressing the issue. So this is the even another is a job cut is normal in across the Asia. And in Asia there are many countries who are main supplying the labor force, and only in case of Nepal we have seen 10 to 30% job loss in respective country. And this is the fate with the different country as well. Go ahead. Next slide. So what we did during this pandemic, we keep continuing advocacy, recognizing COVID as an occupational disease. Organize training on OSH, negotiate with the government, labor ministry, even security personnel, distribute relief package, personal protective gear, sanitizer, mask, food, even training, handling of personal safety, training on mental health. There are a specific action has been taken place in different countries where we ask for the mass testing for the workers for COVID, like in India and in Philippines. There is a specific hotline establishment in the Philippines to address the worker issue. Press meet testing bill, house, even there is already a bill is coming up. More of that solidarity action, press statement, press conference for the industrial incidents, and series of LG gas leak campaign both in India and South Korea, as it has been happened in the. So these are the few pictures where PPE has given to the workers, especially work with the healthcare waste management, and then municipality waste workers. There is a couple of interaction program. There is supply of food and sanitation material, mental health related training, advocacy for recognizing COVID as OD, and then solidarity action for the victims at healthcare camp for the workers. Next slide. So this is the solidarity action for the Vizag. There is a LG Chemicals Polymer Gas Private Limited based in Vizag, India, Andhra Pradesh. And on 7th May, a lot of more than 800 tons of styrene gas has been leaked, causing immediate death of 12, and then another 3 who has been died. So we initiate that kind of solidarity action, press conference, press meet, number of times, and these are the few our materials we develop to raise the profile of this issue, not only in India but also in the Korea. Next slide. So even the last, just the last week in Korea, we have released the press statement with the help of our Korean members, and these are the victims who have lost their life, 15 people. So we are asking LG company both in India as well as in Korea, since Korean company is the parent company, so to be accountable for all these losses, not only the human health but also the all the vegetable environment losses and damages. Thank you. Go ahead. So at the same times, we have seen some of the good response from the respective government, but at the same time, there are a number of bad response from the government. We have been asking government to recognize the COVID as a occupational disease, but so far in my list in the Asia, only Japan, Korea and Malaysia have formally declared COVID as OD. Rest of the country, I don't have information either, or they don't have even declared COVID as OD. Not good humanitarian treatment at the domestic as well as migrant worker in many countries of Asia. As we have seen, even the diplomatic mission was not listening or responding the issue raised by the migrant worker. Increased violence, ill treatment by the government, even by the diplomat, delay response of the industrial incidents. As I said that in the Vizag, India, this major incidents has happened in 7th May, but only the arrest of the management company official were taken of the 6th July. So after 2 months, there is a response to even first hand taking people, culprit people into the custody. So there is a delay response. Still, in many countries, still thousands of workers are struggling in foreign ground without food, shelter, and medical assistance, and they are eagerly waiting to return their home. Government are not able to manage and harness the returnees who are coming back, workers with their working experience, long experience in the foreign ground. This mass has to be used for the national building, and that has not been well planned in many countries, and as a result they don't have any work. They lost the work in the foreign ground and the return, and they don't have work at their respective nation. So future course of action, ANROEV as a collectively we are doing continuing our campaign for the remembering of the dead and fighting for survival's right and justice, strengthening our information sharing and capacity building, continue promoting due diligence, not only with respect to COVID, but also with respect to occupational health and safety before opening or returning to the work. Continue fighting for safe workplace and environmental and occupational safety and health. Organize webinar series for LG victim and boosting networking, solidarity action, and legal support. Even we are thinking of to supporting legally. And this is the final. Thank you. And if you want to know more about ANROEV, please browse this link. You can have the update information from ANROEV, what we are doing. Thank you for giving us chance to share what ANROEV has been doing towards protecting labor rights and workplace safety around Asia. Thank you.
Thank you very much, Ram. Again, some fascinating facts and figures in that presentation there. Just to remind people, we'll be recording this morning's session, and it'll go up on the Hazards Campaign website along with presentations like Ram's, so you can take more time to go through it and follow up the links and get more information out of it. But do in particular follow up the links to ANROEV itself, because I think, as you can see there, it's an amazing campaigning organization. How you find the time and enthusiasm to do everything you do is quite amazing. The figures are truly shocking, particularly those that affect migrant workers and workers in the informal economy, which goes back, in fact, to some of the stuff that Michael was saying about the Australian experience, about where the problem was worse in Australia as well. And I think that's another factor which we see repeated in some of the countries in Europe where there have been spikes and outbreaks, as in Germany in the meat slaughtering plants, for example, too. And that issue of migrant workers and workers who've got no access even to the basic safety net of some kind of social security payments or sick pay if their work stops. I don't know how we're going to deal with that one going forward. In fact, I want to move on now very quickly, although thanks for that, Ram, it was great. But I want to move on very quickly to introduce the next speaker, who is Sanjeev Pandita. Is Sanjeev there? Hello?
Yes, I'm here.
Yes, there. Sanjeev is based in Hong Kong, again in the Far East. So he's a regional coordinator in Asia for Solidar Suisse, which is an outreach body of the Swiss trade union labour movement. And also this year, Sanjay is actually the recipient of the American Public Health Association Leslie Nichols International Health and Safety Award, which is an award that's named after a leading occupational hygienist and campaigner for social justice in the States, who died, I think, in 2017. And the award is given in recognition of outstanding achievements in occupational health and safety outside of the US, to bodies outside of the US or to the individuals outside of the US. So congratulations, Sanjeev, on that well-deserved award. It's quite a prestigious one, but I think you do deserve it. And over to you to talk about the work that you're doing.
Thank you very much, Doug. And thanks once again to Hilda and all the friends in Hazards Network. It is really wonderful coming here again, though virtually, and talking to you all. I would have loved to be with you there in UK, but I understand these are unprecedented times for all of us. And still, I really appreciate this. I think is still going to be one of the largest gathering of health and safety reps in the Northern Hemisphere, or maybe globally. I mean, you are continuing to do a great work. So today I'm going to add on what my colleague Ram shared a little bit about the problems people have been facing in Asia and how COVID has complicated the whole scenario. First of all, I would like to emphasize what COVID has done, which all of us, many speakers have told us before, has exposed what is reality, you know, the extreme level of informalization, extreme level of precarity, precarious work that is going around globally, but to a large extent in Asia, that COVID has actually exposed that, and more people, more workers and more working class who are working in the more precarious sector are getting exposed more and more. So COVID has actually opened up what was reality in Asia just to the broad world. And it has shown how these inequities that exist in different workplaces, actually COVID is going to expose it all. I want to share a little bit information what was also shared about, I mean, what has been happening in Asia with respect to health and safety. I mean, globally, it is estimated around 2.8 million people die every year due to work-related reasons. And this is just an extrapolated data. I mean, nobody knows how many people die in actually, because nobody maintains, I mean, very few countries maintain data. Workers are being exposed to different hazards at workplace is not normal. So when we aspire for the post-COVID world, it cannot be back to normal. It has to be a very different normal than what it was before. And this is the time we have all to come and collectively redefine our world. We don't need weapons of mass destruction. We need more safety at workplace. We need more democracy at workplace. As my friend Ram also explained, what we are also witnessing at this time is rise of autocracy and diminishing of all democratic spaces that existed anywhere. We know health and safety can come only when there are good unions at workplace, when workers and their communities are allowed to organize and to demand better work and health and safety at workplace. But what we are seeing increasingly, all these spaces are being taken away from Cambodia. I mean, China, we know, Hong Kong, India, there are so many states coming up with laws which are kind of suspending labor laws for till the COVID. So COVID is increasingly being used as an excuse to further curb the existing democratic spaces. So we are entering a very difficult world where the spaces are being reduced, and the only power which we had to organize cannot happen because they are putting, it's very difficult for us to come together to unionize and to demand because of the COVID, and the states are bent upon using this opportunity to further break the movement. But there are still some positives happening. As Ram explained, there was an incredible movement against the LG chemicals, which was multi-country campaign, which was from India, where the victims from India collaborated with the labor movement and the activists in Korea, and it was all done online. Even they were witnessing people being arrested online. So this is also something which we are seeing, despite the repression and despite so much repression, people are finding new ways and new platforms to organize, and innovation is happening. I think that's something important we need to carry forward. We need to be together, and we need to find out ways in which we can find a world which will be different than what was in the past, where no worker or no frontline worker especially is exposed to any hazard, be it COVID or be it any chemical. Thank you once again for having me here.
Thanks very much, Sanjay. That again was a very powerful presentation with lots of good facts and information in there as well. It's interesting that you yourself alluded back to Louise's comments at the start of in her first presentation as well. There's a definite theme that runs through all of this about the importance of COVID being a disease which does affect the poor and the working class more than those who are actually powerful and in control of things. And to have that set in that global context and the way in which it reveals the mess that's going on in Asian countries and the conditions that workers have to put up with has been quite shocking. But what's good and positive about it is the organising that's going on to counter that, and that point that we can't return to the old normal, that we do need to have a better normal when we do get control of this pandemic, I think was very, very well made indeed, and I'm sure lots of people would agree with that. Apologies, by the way, for the bomber who interrupted in the middle of that one. Normally, if we were doing this a Zoom meeting, we'd probably try and set up a waiting room to control things and get a bit more security, but we've got nearly 400 people have signed up for this particular event. And because Janet's busy doing all sorts of other things as well, she couldn't be watching too closely in a waiting room. So we've kept it very open for people to come in and out as they can to listen to what's being said. So hopefully it won't happen again, but I'm glad that Janet was able to deal with it quickly on that particular occasion. If we can move on, I'd like to move on now across the other side of the world completely to Massachusetts and introduce to you Peter Dooley, who is Senior Project Coordinator for the US National Council for Occupational Safety and Health. His colleague from COSH, Jessica Martinez, spoke at the Hazards Conference, I think it was about 3 years ago in 2017. And COSH is doing some amazing work in the United States on developing improvements for workers in organising around health and safety in their workplaces. Peter himself specialises in worker education in health and safety and organising workers so as they are aware of the hazards and can organise themselves to protect themselves from hazards, and done a lot of work with the trade unions in the US and also with the federal occupational health and safety organisations. So over to you, Peter, if you could please.
Thank you very much. It's an honor to be with you all and humbling to hear all of the incredible work that's being done around the globe on an occupational health and safety issue that truly unites us all. And it's amazing the similarities that's going on globally, and I think really speaks to the need to be coming together more like this globally, to be sharing what's going on in particular countries and how we can be united and in solidarity with each other to really, because we're all fighting the same fight. I am with the National Council of Occupational Safety and Health, otherwise known as National COSH. We are the sort of original grassroots health and safety movement in the US. We have 25 active groups around the country. We are growing. We've organized 7 new chapters around the states in the last several years. And we're continuing to mobilize and especially around this issue of the horrible effects that our country is facing with the COVID-19 pandemic. Next slide. Obviously, as others have mentioned, again, it's amazing the striking similarities that we're all facing in terms of the essential workers being basically thrown into the furnace, literally, without adequate protections, and particularly, again, low-wage workers are front and center of the pandemic, horrors and disasters, the insufficiency of worker protections, injustice, racial injustice, certain class injustice, and that workers are front and center, being sort of at the heel of, in our country, certainly a repressive anti-worker government. And it all leads to the importance of being organized. And really organizing in this era, which there are so many challenges, but it has exposed, as many speakers have already said, has exposed the injustices that are out there. Next slide. And so obviously low-wage workers, workers of color, have been the hardest hit in the US. Black and brown workers, between 2 and 3 times the death rate. And as in other countries mentioned, nobody knows how many workers are being killed as a result. We're trying to keep track of some of the cases that are more public, but the toll is really not being tracked at all, whether by government or other agencies. Next slide. So one of the, just as an example of, we organized a whole campaign related to worker deaths related to COVID during Worker Memorial Week, in which has become a very, increasingly significant time of year for us. It is the most important time of year related to workplace health and safety, and getting some public awareness to it. This year we emphasized the effects of COVID-19 on workers, on all workers, but particularly those that are most vulnerable. Next slide. So we often talk about not letting a disaster happen without the organizing that goes around it, right? It's horrible, as many of the speakers have testified personally and organizationally, the trauma that's happening at all sectors within our country. Yet it has exposed that injustices and everything. Next slide. And our activity has literally been tenfold since the very beginning of the pandemic. We were very, very closely tracking what was happening in the early development of it in China and elsewhere, and have been very much developing resources to be sharing among our network. Besides our 23 active groups, we also have a much larger network of health and safety activists that are connected, which Hazards plays a wonderful sort of international and global influence in terms of bringing us that level of campaigns that are going around the globe. But we need more of that. But we've been very much in the media. We've been building a lot of new relationships with allies, groups that had been worker advocates in ways other than health and safety. Now health and safety is front and center. And of course we have the experience of how it really works in the real world, which is it doesn't work the way that anybody thinks, right? It doesn't work for workers. And knowing the system and being able to relate that experience. We've also had a lot of new interest with funders and the public in general, as well as organizers, how organizers are using this tragedy to show workers how they need to be, how they need to have a union, how they need to have a worker organization. Next slide. So we've been on national media. This is Jessica Martinez on Rachel Maddow. Next slide. This is me on Good Morning America. Which are these are national media programs and everything. It just gives you an idea of the extent in which our profile has increased related to COVID. Next slide. We released a significant report about what it would take to really return to work and have more safe and just a situation in workplaces and for workers. We've gotten a lot of, and we pulled together like 50 public health and medical, basically volunteers to help us, put this report together. So we've gotten a lot of traction on that. Next slide. Our website has been just, nonstop. We specialize. We have really always tried to have multilingual materials, main ones being English and Spanish, which we're truly a bilingual organization. Next slide. And I put the link to our website in the link in the chat. We've developed a fatality database. Nowhere's near. Now we have 600 cases that we've have some information on. And it's just an example of trying to highlight the personal aspect of it. Next slide. Also, we just released a in memoriam video with Jane Fonda as a, oh, sorry.
You need to unmute, Peter. Peter, you're on mute.
Sorry about that. Just a short memorial for cases that we know that we do know about, to tell the human side of the story. Next slide. That's available on our website. Again, we're out there sort of advocating for, for workers to stand up and fight up and fight despite all of the challenges that are that are out there in terms of discrimination and retaliation to workers. Last slide. And so again, we as opposed to some other organizations are out there trying to sort of raise the flag of how this pandemic only shows the situation that we all know happens every day, with workers being killed, injured, maimed, exposed, and we need to use this as a time to be, sort of coming together and being more organized. So we appreciate the opportunity to be with you and look forward to work together with you in the future. Thank you.
Thanks very much, Peter. That was absolutely brilliant. It was a fantastic presentation there. Again, there's a very, very clear picture coming out about what the problems are that we're all facing and are being really exposed dreadfully by the pandemic, COVID pandemic. The problems faced by precarious workers, the problems faced by low paid, by migrant labour in large parts of the world, and particularly by Black and Asian and minority ethnic workers in this country and in the States as well. I think those have been very clearly displayed, but what's also been very clear in Peter's presentation is the importance of organising against that and the successes you can achieve if you start to organise against that. And like the COSH campaign in America, the HAZAS campaign in this country was formed 40 years ago for that very reason, because we saw that occupational safety and health was an issue that needed to be organised around, but also it's a brilliant issue to organise around, because you can go in, you can actually make a difference if you stand up and you organise and you get your evidence together and you campaign to improve things. And we've seen some very positive evidence of that from our speakers like Ram and Sanjeev as well. So we're really at the end of our speaking list now, I'm glad to say, and we've done better than stick to time. We're actually still quite slightly ahead of time, which is good, because I want to introduce to you next Shelley Asquith, who is the Health and Safety Policy Officer at the TUC. Shelley has to leave us at 11:30 prompt, so I'm glad we're still in time, because otherwise we'd have missed the chance to hear her speak. And it's quite important that we do hear her speak, because she's fairly new to the job. She only just started a few months ago as the Health and Safety Policy Officer, replacing Hugh Robertson, who retired. And Hugh was a great friend of the HAZAS campaign. The campaign relies tremendously on the support it receives from the TUC and from the affiliated unions in the TUC, so it's important that we maintain those links. It's a kind of difficult start to the job, because no sooner was she in post than the pandemic hit Britain and everything went into lockdown, and so she's had to do almost all of the jobs she's done so far virtually through things like Zoom meetings like this and other contacts, but she's made a great start at it. So very pleased to welcome you to your first HAZAS conference, Shelley. Let's hope it's the first of many, and that some of the future ones we can actually hold in person, so you get a chance to actually talk to the reps and activists who turn up to the conference in person, as well as presenting today. Over to you, Shelley.
Thank you so much, Doug, and you're doing an excellent job, I think, of chairing this meeting. And I just want to start by thanking you and Janet and Hilda and all the HAZAS team for organising this conference and for all the work that they do year round. And it's an honour to be part of this international panel and really informative hearing what is going on around the world. But the HAZAS campaign is an absolutely vital resource for this movement, and I know everything they do is kind of on a shoestring. So if anyone who's here today is able to support them through a donation or get your union branch to donate, please do. I just wanted to get a little plug in there to start off with. We really need the HAZAS campaign. I want to start by saying just one name, David Cuthbertson, a road worker who had previously worked on the Piper Alpha oil rig where the disaster happened, who may well have contracted coronavirus while doing his job as a road worker, who leaves behind devastated colleagues and family members. His funeral took place this week after he died from COVID-19. And he is just one of the more than 46 1,000 who've passed, many of them workers who've been exposed to the virus because of the job that they do, whose lives have been ended too soon. And make no mistake, without the presence of our union health and safety reps, the 46,000 death toll would be far higher. But years of undermining trade unions with restrictive legislation, a hostile media, and a government hell-bent on stripping back health and safety regulations, all these things as a background have contributed to how bad this crisis has been and how bad it continues to be. And a government sending workers back too soon, negligent bosses not prioritising safety, and an absent regulator that has often not intervened when it needed to, these have all contributed to just how bad the crisis continues to be. People will be aware that Britain has the worst death rate in Europe. More than 100 people a day are still dying with coronavirus. And there are a number of reasons for that. Firstly, I want to talk about gross negligence manslaughter, a government that sent people into workplaces that weren't made safe enough, quick enough, that didn't have the right PPE, that didn't safeguard the most vulnerable, and didn't lock down soon enough. We know all these things have cost us many, many lives. Secondly, our economy. Even if we had locked down from day one, the fact is that millions of people in this country would not be able to sustain themselves. 2 million are not even eligible for statutory sick pay, and those who are eligible cannot survive on £95 a week. Until everyone is able to take time off due to illness or injury or to self-isolate without having to take a massive pay cut, we cannot protect ourselves from a virus or indeed any other hazard. And until this is changed, we cannot expect to contain this virus or expect a test and trace system to work effectively. The other reason is the racist nature of our capitalist economy. We've all seen the devastating way in which the number of COVID infections and deaths are disproportionately affecting Black, Muslim, migrant workers. Many of you will have also seen the shameful comments by a Conservative Member of Parliament just yesterday saying that the high levels of coronavirus infection and deaths amongst these communities is because they aren't taking things seriously enough. A disgusting attempt to turn people against each other and deflect blame away from the government, who are the ones guilty of not taking things seriously enough, not taking seriously enough the lives of working class people, not taking seriously enough the racism which puts those Black, Muslim, migrant people more often in the frontline high-risk jobs, more often in prisons and detention centres and overcrowded housing where viruses spread quicker, more often in receipt of poverty pay, meaning they cannot afford that time off. And so our fight for safer work has to go hand in hand with the fight against racism. Today is quite a significant day because it's also the day that the government has decided that those identified by the National Health Service as extremely clinically vulnerable can stop shielding and go back to work. When the rate of infection is rising quite rapidly and millions of people are back in local lockdowns as of yesterday. So we need to firmly oppose any of those people being forced back to the workplace and for the shielding support to be urgently reinstated. We also need to ensure that all workplaces are safe, whether there are vulnerable people in there or not, because everybody, let's face it, is vulnerable to this virus. And there have been inspiring examples of workers organising to protect themselves and their colleagues, winning occupational sick pay, winning safety measures and support for the most at risk. But to take those efforts into all sectors and to make everywhere safe, it must mean deploying our army of union health and safety reps, of which there are now around 120,000, into the non-unionised workplaces too. The Scottish Government has said that it wants to support this happening everywhere, but it has to be the UK government that legislates for roving reps. This is even more important when we take into account the fact that we don't seem to be able to rely on the health and safety regulators to ensure workplaces are safe. The Health and Safety Executive, as far as I'm aware, has still only required one business to close during this period. When we all know of instances where people have been put in unsafe conditions, even reporting them, with failure after failure to supply the right PPE. And the government's response was to give the HSE a 10% funding boost when it suffered an almost 50% funding cut in the last decade. It's like sticking a knife into our backs, pulling it out a few inches and expecting us to say thank you. So without the regulators and the enforcers doing the job they're supposed to do, bosses are free to flout the rules, and they do, and we know this. And when we know we cannot rely on this government to keep us safe, we cannot rely on most employers to keep us safe, we cannot rely on the safety regulators to keep us safe, we have to, as we always have, organise in our unions to keep ourselves and our colleagues safe. And Peter so clearly talked about the urgent need for this organising just now and what that can look like. Just like in warfare, the ruling class has little concern for the lives of the working classes heading out into life-threatening danger to do a job that protects their economic power. We have to be just as ruthless. Our murderous government must be opposed, negligent bosses must be jailed, and every effort to subvert union power has to be out-organised. Our collective power is the only thing that we can rely on to protect our colleagues and our class, so we will fight for nothing less. We'll fight until every worker has access to safe work. And comrades, while we remember the more than 46,000 people who've passed from coronavirus and the many thousands more who've died from other work-related illness and injury, our slogan, "Fight like hell for the living," is not a platitude, it is a call to arms. Solidarity and power to you all, and thanks once again to Hazards for having me here this morning.
Thanks very much, Shelley. That's fantastic. If only there was some way of actually hearing the applause of people who are all listening in to a Zoom meeting, it'd be great. I'm sure all of our speakers would have had quite massive rounds of applause for the power of what they were speaking about. It's great. The comments about the HSE, I think, were very timely as well. It's interesting, just this morning, they've announced the new chair of the HSE. That's going to be Sarah Newton, who until recently was an MP, and in fact, until recently was the minister who had responsibility for the HSE, among other issues, in the DWP. And it's the first time, I think, that our colleagues in Prospect can perhaps put me right if I'm wrong, but I think it's the first time we've actually seen such a political appointment to the head of the HSE, which is further undermines the HSE's independence, which has already been undermined over the last 10 years by the Tory government, and it doesn't bode well for it being able to be a more powerful regulator going ahead. So things are quite serious in that respect, and you're right, it's important we organise on that kind of issue. And in fact, that's why it's so important that we've got the workshops this afternoon, and I hope most of you can stay around for the workshops, because that's where we'll get into a bit more discussion about how we do actually organise, particularly how we organise in the current climate where face-to-face meetings are difficult to organise with people, and contact has definitely slipped. Certainly in my own unit, it's been proved very hard to keep in touch with members and reps because of the changes that have been going on. So there'll be a lot of that discussion this afternoon about how we do organise effectively in that kind of way. But before we get to that, we've got one final speaker for this morning's session. I'm glad to hand you over to Janet Newsom, who is the coordinator of the Greater Manchester Hazards Centre and is also the chair of the Hazards Campaign. And it's Janet and Hilda Palmer who are largely responsible for today's event. So again, a big round of applause to them for organising this and pulling together such a fantastic selection of speakers from across the globe to give us a truly global picture of what's going on and the struggles that the working class and unions are involved with globally as well. Over to you, Janet.
Hello everybody. Sorry, I just got distracted then by the waiting room. And I'm sorry for the mess up before when people came into the event. So I've been working with Hilda and others to try and deal with what we're faced with in terms of this lockdown and the lockdown and the pandemic. And we started off from being locked down, trying to put demands to the government and to campaign to hold them to account. And it's been interesting, really, you know, from a health and safety point of view. For the first time, health and safety has been at the top of the agenda. And I, you know, appreciate the points that Peter made before, that we bring a different element to it. We bring the reality of what's going on in workplaces to the table. So we've been campaigning to hold government to account, to try and hold the enforcement authorities to account, which have been, I have to say, absent during this pandemic. And to try and hold employers to account, because although we've supposedly had a lockdown, we actually haven't had a lockdown, a total lockdown during the pandemic. lots of workplaces have remained open that have been non-essential workers, with non-essential workers in them, putting them at risk. And we've seen the results of that through the Leicester lockdown, which showed, you know, the sweatshops that some of the people were working in without any enforcement bodies going in to ensure their health and safety. So we've held a number of online events. We held our Workers' Memorial Day online for the first time, and tried to hold a dignified remembrance of everyone that had died and as a result of work. And that was made even more poignant this year by the number of workers that had died because of COVID-19, especially the ones, the essential workers, the ones on the front line of dealing with COVID-19 in the health service and the care workers. But I mean, there's lots of other essential workers that we've been supporting and certainly recognised. You know, the bus drivers, the taxi drivers, those in shops, delivery drivers, lots, you know, and the emergency services as well. So there's lots of workers that have been working through the pandemic that have been badly let down by the government, not least because of the PPE that wasn't available on the standard of PPE that's been absolutely appalling and has left, you know, lots of people dead and lots of people with disabilities as a result of contracting the virus. We've issued press releases, we've written to MPs, we've been working with reps to give them some advice on how they can, supporting trade unions and working with reps on things like risk assessments and individual risk assessments. So we've been delivering briefings with trade unions to those members. We've spoken at events. We've had social media campaign to try and influence the agenda. And this week, so we during the pandemic, we called for, we produced a paper which was, if we go back safely or not at all. And that's our position, and it has been since early on in the pandemic, that workers shouldn't be in work unless it's safe for them to be there. And even the essential workers need to have the proper PPE and proper standards of health and safety to protect them. And that's got to be the bottom line. There's been some deadly failures in this pandemic, you know, through government positions, through the government's position. And yesterday we issued a press release on top of the latest lockdown. And I'll just read you a little bit from that. So we called on the government to immediately adopt a zero COVID-19 policy. So we think that's got to be the answer. That's what they're heading for in Scotland, and they're certainly bringing the numbers of transmissions, the number of deaths down as a result of that. And that's got to be our bottom position, our bottom line. So it's a zero COVID policy or strategy with the prevention of work-related infection and transmissions as a priority, or the resignation of the Prime Minister. And I'll just explain that a little bit more. It's not just an open threat. So Hazards Campaign demanded that the government implements this zero COVID transmission and ends its knee-jerk reactionary responses to the transmission that's blaming individuals, and we've seen the latest one that Shelley referred to before, which are downright racist, some of the interventions by some of the MPs, and it blaming individuals rather than its own incompetence. And the government's created a chaotic and irrational response to the continuing transmission of the virus, and it's ignored work as a major site of infection and transmission, which we know, we firmly believe, is the centre of lots of the transmissions, even though they're trying to say it's in people's houses. And it's inevitably going to lead to more deaths and more people left with debilitating health conditions, and prevent any return to normal life. So we think that the lockdown, as has been said before, the lockdown came too late, they eased restrictions too early, they didn't fully lock down, they didn't even meet the 5 tests before reopening the economy. And we're calling for the resignation of the Prime Minister, because we believe that he's lost the trust and confidence of the population, not least because of Cumminsgate affair. And that ability to drive down the virus out of the country, which is essential for all our futures, mental and physical health, as we've heard earlier. So we've got a lot more campaigning to do. We're trying to work with scientists, with researchers, with the Hazards magazine, which has been a fantastic resource, Rory O'Neill, and with other academics, many of whom are on the call today. But a special mention for Andy Watterson, who's been doing a tremendous job trying to feed in some of the research that that's been about to try and help workers. you know, when we're talking about sending school teachers back to school in September, back to schools in September without any PP, without any proper risk assessment being done, without any check on those risk assessments that they're going to protect workers, then we know that's going to make the situation whole lot worse. And so we've got to do more to protect workers, to put pressure on the enforcement authorities to actually enforce our health and safety laws, and to drive home to government that they have to do something differently, something more, and to protect workers. So thank you very much for all the speakers. I'm really humbled to be speaking with you today and to listen to the contributions that you've made from around the world, and Shelley in the UK, and absolutely Louise, putting it all into perspective really about what this is all about. So we remember the dead every year at Workers' Memorial Day, and we will continue to do that, but we're here to fight like hell for the living. So thank you very much, and hope you enjoy the rest of the day. And sorry, just to say thank you very much for the speakers and people in the workshops that are going to be coming up later today. Thank you.
Thanks very much, Janet. Good way to sum up. Just to wind up this particular session, I would also like to thank very much Louise from Scotland, Michael from Australia, Yanni from Denmark, Ram from Nepal, Sanjeev from Hong Kong, Peter from the United States, Shelley from the TUC in London, and Janet herself for this morning's presentations. I think it was a really, really powerful morning this morning. We've learned a hell of a lot about what's going on out there. It's amazing the things that are in common across the globe in this pandemic, and the issues that are being exposed by it. Addressing well, and that's why this afternoon's workshops are so important, because there'll be more time for interaction in the workshops. Hopefully, they've all got brilliant panels that Janet set up as well. The first one of those workshops starts at 12 o'clock with the theme of safety reps taking the lead during and after COVID-19. So very much fits in with that message that's come out loud and clear from this morning, that we need to be organising in response to this pandemic, and there are things that we can do if we are organised to actually make sure that our members are protected and that workers in general are better protected against the pandemic. Please do look out for this going up on the Hazards Campaign website, and look out in particular for the presentations, the presentation from Ram and from Peter, and follow up the links that are in those presentations and some of the links that have been put up in the chat group this morning, because organisations like ANROEV desperately do need support from ourselves in this country. And can I also just finally make a plea for Hazards Campaign itself? Normally when the Hazards Campaign organises the Hazards Conference physically, the physical conference actually is an important source of income for the Hazards Campaign, because there's an appeal goes out to the unions, there's all the costs of organising it, which can be legitimately claimed by Hazards Campaign as costs for the organising involved. Because this year we've had to cancel the physical conference, that hasn't happened, and it's left a big hole in the finances for Hazards Campaign and for Greater Manchester Hazards Centre as well, which does a lot of the organising work. So if there are any branches out there that are able to donate money to Hazards Campaign or to GMHC in the Northwest, then please do so, because the work they do is incredibly important, and it's done on a shoestring, and we need to keep that continuing where we can. So thank you very much to all the speakers. Thanks to you who've all been listening, and I've not seen the numbers drop at all, particularly all the way through this morning's session. It's been great. And please hang around for this afternoon's workshops and get involved and have your say in the afternoon's workshops as well. Thank you, and goodbye for now.
Bloody good job, everybody. Bloody good job. Thank you very much.
Thanks, Janet. I thought that was brilliant. I think you managed to deal with the bomb.